Good afternoon, everybody. My name is Ben Reisinger. Welcome to Mary Free Bed Rehabilitation Hospital's Google Plus and YouTube page. I'm here today with Dr. Stephen Bloom, sir, and I am here with Sheila. And Sheila Bennett is a former patient of Dr. Bloom's and the outpatient concussion program. Thank you for being here.
Glad to be here.
So here we are talking today about brains, concussions. It is trauma season. Doc has the brain right there. And concussions affect everyone. A lot of times people don't even realize that they've suffered a concussion. So what we're doing here today is we're going to chat with Dr. Bloom some easy, candid questions about that can give you just a little bit more information to make you a little bit more educated about what a concussion is, how you would treat a concussion, and we're going to talk with Sheila here about her experiences in our outpatient program. So again, this is our live web chat series. You can find us on Google Plus and YouTube, and we'll just get right into the questions. So Dr. Bloom, if you could just tell the viewers, what is a concussion exactly, please?
A concussion, by definition, is a brain injury. Mm-hmm. We call it a mild brain injury, but it's nonetheless an injury to the brain. Mm-hmm. What happens in a concussion is if the head takes some sort of blow, say it's a sports injury, two football players hit helmet to helmet, or maybe a car accident where you hit your head on the back of the car seat, or maybe even just a whiplash injury where your head gets thrown around, that can cause damage to the brain. In concussion, it's microscopic damage. In other words, the cells in the brain are very soft and gelatinous. I always tell my patients the brain tissue in a live human being is kind of like jello or yolk.
So one of those squishy balls.
That's exactly what it is. Yeah. So if there's a blow to that brain from any direction, it causes forces through the tissue of that brain, almost like little shock waves that go all the way through that brain, and it causes microscopic swelling, or edema, we call that, which causes damage to those cells. Now, when we do a CAT scan through that brain, it all looks normal because there's no bleeding. It's very microscopic. In fact, even MRIs aren't quite sensitive enough to see that swelling, but nonetheless, it's still there.
Okay.
It's that swelling that causes the damage to those nerve cells in the brain, causing those symptoms.
Okay. Thus, then happens a concussion.
Yeah. So what happens is the blow itself may not be the thing that causes the most damage. It may be those forces going through the brain. Depending on where the brain is injured or where those forces go to, it can cause symptoms that are consistent with that lobe. We know in the brain, there's different portions of the brain that control different activities. So those forces, if they translate through the covering of the brain, that may cause problems with memory, concentration. It's called the cortex of the brain, or the ability to do multitask. So patients with concussions have problems concentrating, have problems at school, at work. Those forces may go through the inner ear portion of the brain, or the temporal lobe, which helps control balance. So they may have dizziness or feeling like vestibular symptoms where they just can't get their balance, particularly if they turn their head quickly. It may cause problems with vision in the posterior aspect of the brain, or those tracts that go up to the eyes. That may cause problems with light sensitivity, difficulty with double vision, difficulty processing information, and able to read and comprehend materials.
Okay.
And then, of course, the brain is the center for all kinds of things. Sleep centers can be affected by this. Emotions are very commonly affected by this in concussion. The ability to just simply stay alert and track on things are affected with concussion. So anywhere in the brain that can be affected by these shock waves can cause these symptoms that concussion patients commonly present with.
Okay, thank you. So basically, it depends on where the brain itself is hit and like what direction it might go as to what your symptoms are with the concussion.
That's correct. Yeah, and there are certain lobes that are more sensitive than the others. The brain itself sits on top of a kind of shelf within the skull, and it sits on little bony structures that, as the brain jiggles around on top of these bony structures, it can cause microscopic swelling through that area too.
Wow.
And it's important for people to actually know that this damage of the brain, this brain injury, sometimes appears to be very mild, like you said. Sometimes people don't even know they've had one. We very commonly have patients come in who've had a car accident, didn't get knocked out, which, by the way, you don't need to be knocked out to have a concussion. In fact, very few of them do get knocked out. And they may be full of adrenaline after the car accident, just don't realize they had any symptoms. A few hours later, or maybe even the next day later, they wake up, they feel terrible, they're nauseous, they got dizziness, they have headaches, all kinds of symptoms. So, and sometimes those concussion symptoms take a little while for that swelling to occur and become apparent.
Mm-hmm. And Sheila, you are here, and if I can ask, what brought you? What was your brain injury? How did you suffer your concussion, please?
Well, the day after the accident, I started forgetting things, and I was dizzy, and I kept losing my balance. And I went to my primary doctor, and she says, you need to go see Dr. Bloom.
Okay. So you were in a car accident,
Mm-hmm.
and then your doctor, after you started to suffer these things, said, come and chat with Dr. Bloom.
Mm-hmm.
How was that when you first came to Dr. Bloom? How did he diagnose you? You know, how was the start of your treatment?
Well, I answered some questions. I did like a little questionnaire, and he reviewed it and thought I needed some rehabilitation here at Mary Free Bed.
Mm-hmm. Okay. So after that started, tell us a little bit, you know, Dr. Bloom, what did you think of Sheila when you diagnosed her, when you were looking at her treatment? You know, what did you see from her injury?
You know, Sheila presented very commonly with the type of symptoms that we have for patients with concussion. Problems with balance, dizziness, problems with memory concentration, difficulty with vision, headaches. And interestingly, the brain itself doesn't feel pain, but there's structures within the brain that feel pain. And these are very classic symptoms. Now, when patients present with these, oftentimes the physical exam findings or the neurologic exam is very subtle.
Okay.
That's one of the things we specialize in the concussion program here at Mary Free Bed. It's been around for about 18 years now, and so we've gotten very good at filling the clinic with specialists who just deal with this. Physicians, nurses, therapists who are very good at picking up on the subtle signs of concussion. When Sheila presented, she had all those kind of classic things that we see. Very subtle changes in how the eyes move, sensitivity to light, provocative maneuvers to induce the dizziness. Typically, the exam appears to be normal to most people who do a physical exam after this. But when you deal with concussion a lot, there's a whole lot of little subtle findings that we find. And Sheila had a lot of those findings. So with that, we're able to make the diagnosis of concussion and initiate treatment.
Okay.
What I always tell patients when they come in, you know, unfortunately, there's not a magic pill for concussion or a magic shot. I would have given it to you that day.
No.
Wish I had that. If I could figure that out, that would be the holy grail for concussion. But what we found over the years is that rapid initiation of rehabilitation or treatment with therapy for concussion gets our best outcome. So we got her right into our multidisciplinary rehabilitation program here at Mary Free Bed. That consists of a whole team of specialists that just deal with concussion. Physical therapy for the headaches, the balance, the dizziness issues. Speech therapy, looking at memory, concentration. I always call this exercises for the brain.
Sure.
That's a great way to describe that. Trying to help with that focus and recovery. Occupational therapy, looking at a couple different things. One, how a patient may go through the course of their day, whether it's cooking, cleaning, hygiene, work, things like that. But also occupational therapists look at visual problems that are very common in concussion and get to the exercise of that. We have a brain injury psychologist who's a PhD neuropsychologist that works on testing of brain damage after these concussions and help guide the team. And of course, a rehab nurse, and we also have recreational therapy and vocational therapy in the program, along with driver's rehab. I'm a specialist in physical medicine rehabilitation and a brain injury specialist, so my role is kind of captain that ship, looking at different medications that we may need in a case like Sheila's and kind of guiding that treatment team. So Sheila came in, how many days a week did you initially start out at?
2 to 3 days a week, every week.
Every week.
Every week. And then once we put the recreational therapist, and I was doing sometimes four days a week.
Wow.
It's intensive. We
That's
find
very intense.
We find that the key for concussion in our program in terms of outcomes being good is get them into treatment rapidly, and make sure that it's comprehensive testing. I think in the old days, people used to look at concussion, the treatment of concussion is rest, just rest. Well, we know now that after that initial 72 hours, you don't need to rest a patient with concussion. In fact, you need to mobilize them. And we find that integrating that therapy very rapidly and getting them off some of the stronger pain meds that they may be put on initially is the key to success. And it's best if we do as a team. So how long did you have to go under rehabilitation? How many weeks did we do for you?
I think 16, 17 weeks.
Yeah.
Wow.
Yeah, Sheila was pretty, she had a lot of symptoms. And then in a car accident like hers, you also have other injuries. She had some difficulties with her knees. And you often have whiplash injuries in your neck, so the team
Sure.
has to treat that too. It makes it very complicated. Now, some of the treatment, depending on the concussion, is simple. Some of the the less severe concussions, particularly some of the sports concussions, they may only need a week or so of therapy to get them back into their sport and symptom-free. It all kind of
Obviously with
depends.
Sheila as being almost 4 months
Yeah.
and things like that. So that was more of a rougher concussion.
Yeah,
Correct?
we
Yes.
have it, and that's kind of on the longer end of treatment. But we see, concussions are they call them mild brain injuries.
Okay.
It's kind of silly. Any injury of the brain I consider is serious. I consider the
Yes.
brain to be an important organ, or one of the important organs of the body. But they can be complex. In other words, lots of multiple symptoms like Sheila's or prolonged symptoms, or they just may be simple concussions that resolve relatively quickly with just a conservative treatment.
Sure. So what did you think of treatment? Tell us, Sheila. Was
Well,
it harder in the beginning? Did it get easier? Was it
Yeah.
the whole way through? What'd you think?
Actually, I don't know what I would have done if I hadn't come here.
Really?
The staff, the therapists were all exceptional. They cared about everything for their hour, each hour with me, of each different therapist. They worked very hard, and it was directed just for me.
Mhm.
They encouraged me. I had homework.
Wow.
And I would have to go home and practice my exercises. One of them I didn't understand in physical therapy for a while was they make me dizzy, and that would help prevent me from getting dizzy.
Mhm.
You have to go like this with your hand,
Yes.
back and forth, and it does make you dizzy.
Sure.
But once you're conditioned to it, then you can do this without feeling dizzy all over.
Mhm.
Um,
What was some of the toughest times of your rehabilitation? What were some of your tough days?
not knowing I would get up to do something, and I didn't know why I was up or where I was going. Once I realized that I taught a cooking class.
Okay.
I couldn't cook anymore. I tried to, and one day the kitchen filled up with smoke because I left the pan on the gas stove
Too long.
too long. My husband started cooking after that, and I would
He's
leave
sitting right over there laughing.
I would
He
leave the
is
burners
watching,
on.
yes.
When I did make something, I'd leave the burners on and walk away. That was scary
Mhm.
because here, I teach a cooking class to people, and I couldn't even make simple oatmeal without burning something or walking away. It was scary, and I get frustrated where I normally wouldn't get frustrated with things, and I got upset real easily. I know one time my insurance agent, my medical adjuster, really upset me, and so I gave her a piece of my mind. But normally I would never do that.
Yes.
But it was the agitated
Mhm.
from the concussion I did that.
Yeah, that's very common. In fact, I saw a patient this morning in the clinic who tried to go to work after their concussion, and they're a higher level executive and could not do anything on the internet, could not find files, couldn't track where they had notes, and ultimately had to stop working after a few days because it was so significant. And then went into a deep depression about it while they were dealing with the symptoms. Anger was a big issue, and that's part of the damage to the brain. You're feeling lousy too, so you're just not feeling good.
Sure.
But there's actual physical damage done to those emotional centers of the brain that come out in a concussion. And patients get really frustrated with that. In fact, I've had patients say, I would have rather had a broken arm in this car accident so I could people could see me in a cast. My problem's up here, and people don't understand what the issue is.
So we talked about some of your tougher days. So obviously that got better.
Yes.
Correct. Yes. Okay. That's a great smile. So after a few weeks, couple months, how you started to see things get a little easier for you. Things are a little bit more clear for you.
I think I realized after about 8 weeks I was heading in the right direction. I was so overwhelmed with everything going on in the beginning. I just followed directions, and I did everything I was asked, and I really worked hard at it. But the therapists I can't say enough about the therapists here at Mary Free Bed.
Thank you.
They are kind, they're understanding, and they work really hard with the patient.
Fantastic. Well, we try to say our therapists are kind of our bread and butter. I mean, we are a rehabilitation hospital here. So I'm glad that they did well for you. So, let's fast forward to, Sheila, I'm focusing on you here real quick. So how are you doing today? I mean, it got better, so if you say, we started here and then we're here, where are you at here today?
I'm doing great. I'm at the end of the road.
Mm-hmm.
Now, sometimes if I get up to do something, I stop and I think, and I thought, oh yeah, that's what I'm doing. But I don't have to do that too often.
Okay, good.
Are you educating other people about concussion? I mean, that's one thing when people go through a concussion, all of a sudden they look at other people doing activities like riding a bike without a helmet or not wearing your seatbelt or not being careful on ladders and things like that, and they become advocates for preventing these concussions.
Mm-hmm.
Yeah.
Absolutely.
So how's your days now? What do you, before we started here, Sheila was telling us she's now in the pool swimming as well. So
I'm swimming in the pool with my husband, something that I had done since I retired 4 years ago.
Mm-hmm.
We would go about 5 days a week. And I'm back into crafts again.
Okay.
I'm doing some craft fairs this fall, making wool mittens out of recycled sweaters.
Oh, very nice.
Seafoam candy and homemade salt caramel corn.
I might have to see you back in the clinic soon.
That's delicious.
It's very good.
So
mine is good.
Oh, fantastic. So Doc, Sheila is done with her treatment here at Mary Free Bed, and so she is now an alumni of Mary Free Bed. And so, to ask, what are some preventative measures then that people would need to take, just if they're outside or they're being active, things like that? Are there things that you can do to help prevent receiving a concussion?
Definitely. Depending on what activities you're doing that put you on risk, you want to make sure you have safe environments. Obviously, with sports concussions, football or soccer, any of these other activities, you want to use good techniques, good tackling techniques of football. You want to make sure your gear's fitting well, helmets, mouth guards, things like that. In the workplace, always following safety precautions, whether that's wearing a hard hat or eye protective gear. You always want to make sure you're safe with that type of stuff. Cars, making sure you're wearing your seatbelt, driving defensively, making sure you're aware of your surroundings. And we also just get a lot of concussions from what we kind of call knucklehead things. People slipping on stuff on the floor or tripping over their cats and dogs. So just being aware of that. When someone's had a concussion, they become much more aware of the risk of damage to the head. And it's very important that people be aware of those things because studies are starting to show that if you have had a concussion or a series of concussion, the brain might be more susceptible to more concussion or worse concussion. In other words, that's correct. So even though you're healed from the concussion, you have no symptoms of it any further. If you have another concussion, it might be a little bit worse or it might be a little bit longer. So protecting the brain's a good thing.
Sure. What type of advice would you give Sheila moving forward now? And just real quick, just to let the viewers know, Sheila was wearing her seatbelt when she was in her car accident. Even with wearing her seatbelt, she still suffered a concussion.
Yeah. Oh, yeah. Even wearing helmets, seatbelts, all that, you still can have concussion. It'll diminish the risk of that. So in her case, continuing to wear the seatbelt, continuing to be safe for the driving.
Yes.
Sheila's a bike rider, also wearing that helmet is critical. We're always harping on that. And then the other thing is, if you do have an injury and you're not sure you've hit your head or not, to seek attention for that. It's very important that if those symptoms persist or obviously get worse, you've got to get in, first of all, for emergency evaluation with a doctor in the emergency room, just to make sure there's not a serious neurologic problem. And then if those symptoms persist, ask for a referral to a concussion clinic where they can get evaluated by specialists, because the whole name of the game here is early diagnosis and early treatment. Many of these concussions without appropriate treatment can have symptoms that go on for months and months. In fact, the more severe ones, on average, are 3 to 6 months of symptoms like that if they're treated. In fact, we have patients who have symptoms all the way up to a year before they get treated, and a very small subset of concussion patients may have chronic symptoms for the rest of their life. So the earlier the treatment, the better.
So time is of the essence.
It is, yes.
When this happens. happens.
Absolutely. Yep.
And again, you said a day or two after, you felt that and you knew you needed to go in and see your doctor. So you were very proactive about your injury.
I could tell things were changing on me, and I couldn't figure out what was going on.
So you knew you had to go and figure something out. Okay.
Right.
Doc, where can people go for help if they have suffered a concussion? They are in the West Michigan area, the Grand Rapids area. Are there resources that they can go to?
Yeah, here at Mary Free Bed, we have the concussion program. It's called the post-concussion program. It's been around for over 18 years now. It's an outpatient concussion program that just specializes only in brain injury and concussion. There's kind of two divisions of it. There's a general concussion program where patients have had maybe motor vehicle accidents or industrial accidents, slip and falls at home. And then we have a subdivision there, which is a sports concussion program.
Okay.
And all ages, all patients are welcome to get referred to this clinic. You can get a referral through your primary care physician or your specialist. You can also just call Mary Free Bed and say, I've had a concussion. How can I get into this clinic?
Okay.
If you just go to the website at maryfreebed.com or ask for Mary, you're going to find a link on there that takes you right to the concussion clinic. And we have this clinic multiple days a week, and so we see lots of patients through there. The big thing is call. Look for guidance for this. If we think we need emergency evaluation of you, we can guide you into the right place for that testing also.
Okay, great. And real quick here, before we end up our first web chat, we did put out there if anybody had any questions about concussions on social media, and we did get a response. So this question is for you, Dr. Bloom, and this is from Melissa Yeager. She says, Dr. Bloom, in the book, The Ghost in My Brain by Dr. Clark Elliott, he describes a therapy that assisted him, which included a type of visual therapy and cognitive restructuring. I realize that such a long-term difficulty after concussion is rare, but are these therapies going to be added to the post-concussion clinic at some point?
Yeah, thanks, Melissa, for that question. Actually, she was talking about this a little bit. Problems with vision, eye tracking are critical to diagnosing concussion and then adequately treat. And what this book and also that physician has kind of pioneered is the concept that eye exercises will help accelerate treatment of concussion and brain injury because of the integral connection between vision, eye motion, and the balance centers of the brain and how information flows through the brain. So within the concussion program in Mary Free Bed, we have specialists in eye therapy. In fact, Sheila actually had some of that work on the right exercises to control the recovery of that, along with the physical therapy. Neurooptometrists and neuroophthalmologists, which are physicians specializing in eye diseases and brain diseases, also work with the program to help us specialize that treatment along with the exercises. There are certain things that may be helpful, including prisms in the glasses or higher level patching of the eyes that we sometimes use too. And the interesting thing about this subject is it's very specialized therapy. Every patient presents with a different set of needs, so they need a different set of exercises. This isn't something cookie cutter where we can just rip a page out of a book and go, here you go, Sheila, here you go, Melissa, do these exercises.
Each specific, injury.
Yeah, it has to be. So that's why I think it's very important that if you're struggling with these symptoms, whether you are aware of visual problems with this, make sure you get into a center that has these services who do this regularly. Okay. These aren't the type of therapies that kind of average therapist who treats a lot of other things can do. There's a lot of extra training in this. There's neurocognitive rehabilitation training to become a specialist in this. And so don't despair if you've got these symptoms. There's treatment for it, but you got to get in for it.
You got to find it.
Yeah.
Okay. Well, that's it. Thank you, Dr. Bloom. Appreciate it very much. Yep. Thank you, Sheila, for being here with us. And again, if you have any questions about Mary Free Bed, you can visit us online at www.maryfreebed.com, or you can dial 1-855-ASK-MARY, and we will be there for you today. So thank you very much. Have a great day. And as always, ask for Mary.